Bismillahirrahmanirrahim. Assalamu alaikum. I hope all of you are doing good with the grace of Allah Almighty. I am Ayesha Asim from Superior University, Lahore. Today we will talk about squint. Squint refers to a condition in which two eyes are ill positioned, which causes turning inward, outward, upward or downward of one eye while the other eye looks straight. So, today you are going to learn what is squint, its classification, causes, symptoms and treatment. Let's discuss what is squint. Normally, when we look through two eyes is together, that two of our eyes should be perfectly aligned. That means to say wherever the right eye is looking, the left eye needs to look at exactly the same spot. There can be situations when the two eyes are not perfectly aligned with each other, and in such a scenario, one eye might be looking at a certain object and the other eye might be slightly deviated from its position. When this deviation happens, we call this deviation as squint in common term and strabismus in medical terminology and technical terminology. Now we are coming to its classification. Squint are classified in two categories, Heterophoria and Heterotropia. Let's look at the first type of squint, Heterotropia. It is the manifest deviation in which fusional control is absent, motor fusion. Then heterotropia is further subdivided into three types, which are on the basis of vertical, horizontal and torsional. Horizontal squint is defined as an ocular misalignment of one or both eyes horizontally. Then this horizontal squint is further subdivided into esotropia and exotropia. Esotropia are turning in of one eye relative to the other eye. This condition is known as esotropia. Exotropia are turning out of one eye relative to other. Then this condition is known as exotropia. On the left side of given figure, we have esotropia, which shows the turning of eyes in the inward direction, while on the right side we have the example of exotropia, which is showing the upward turning of eye. Next we have vertical squint. It is an ocular misalignment of one or both eyes vertically. Then it is divided into hypertropia and hypotropia. Hypertropia is defined as turning up of one eye relative to other eye is known as hypertropia. A turning down of one eye relative to other eye is known as hypotropia. On the upper side of given figure, we have hypertropia, which shows the turning of eye in upward position, while on the lower side we have the example of hypertropia, which is showing downward turning of eye. In torsional squint, there is a twisting of one eye or both about the eye's visual axis. It is then subdivided into cyclotropia and encyclotropia. Now, let's take a look at the second main type of squint, Heterophoria. It is derived from two words, hetero and phoria. Hetero means different, while phoria means physiological position of rest. It is the condition of eye in which the directions that the eyes are pointing are not consistent with each other. It is both a latent strabismus and squint in which visual axes are normally directed to the point of fixation but deviate when the eyes are disassociated. Then, on the basis of direction of deviation, it is further classified into 4 types: Orthophoria, Esophoria, Exophoria, and Hyperphoria. If the visual axes are found to be parallel when the patient views a distant object and all stimuli to fusion have been eliminated, this condition is known as Orthophoria. Esophoria or latent convergent squint is defined as if the visual axes converge toward one another are called Esophoria. Exophoria or latent divergent is defined as if the visual axes diverge away from one another. This condition are called Exophoria. If one of the visual axes deviates above or below, called Hyperphoria. Now, what are the causes of squint? The main causes of squint is the disequilibrium of brain coordination with the eye movement muscle. Other reasons which can cause squint are a positive family history. Low birth weight is when baby is born weight less than 5 pounds 8 ounces. Premature birth, it means birth before 37 weeks of pregnancy. Hydrocephalus. With hydrocephalus, nerves can be weakened, producing eyes misalignment. Adults may experience double vision as a result, while children may see double vision at first, but without treatment will soon develop a lazy eye. Graves' disease, thyroid eye disease or Graves' disease cause lid retraction, proptosis, decreased vision and strabismus. Refractive error. Refractive errors are in simple words called glass power. They have A minus glass power or A plus glass power, that is myopia and hyperopia. Each of these can be responsible for causing squint. Let's discuss the sign and symptoms of squint. Eye fatigue, double vision, reading difficulty, and overlap or blur images are the sign and symptom of squint. Now we have the treatment of squint. What are the possible ways for the management of squint? Eye exercises, refractive lens, vision therapy, eye patching, botulinum toxin are the non-surgical treatment of squint. Surgical treatment involves injection into the eye's muscle. They weaken the eye muscle, which can help the eyes line up better, but the effect usually lasts than 3 months. Surgery. It involves moving the muscle that control eye movement so the eye line up correctly. Squint surgery is very common eye operation. It usually involves tightening or moving one or more of the outside eye muscle, which move the eye to change the eye position. What are the goals of treatment? The goals of treatment acts as a map that points the way toward a healthier condition. Straight eye, good vision, binocular vision are the goals of treatment. I would like to thank you for your time and attention.